Hi everybody, welcome to the webinar to this evening. I'm Catherine Maslin, Principal Naturopath and Clinic Director of Brisbane Natural Health. And in this webinar I'm going to be talking about something that I talk about every day in clinic with my patients, which is answering the question, is dairy really healthy or not? So dairy is a food that gets a lot of press with the media and the kind of mainstream, I guess, health community as being a healthy food that's high in calcium and all of these kind of things. But I really want to debunk some myths tonight and talk about if it is actually going to be a healthy food or not for you. So we're going to cover a few things tonight. We're going to have a look at the pros and cons of consuming dairy. I'm going to talk about the health properties of each type and which one might be better, why low fat isn't actually better. I'm going to talk about how you can actually find out if dairy is right for you. So I'm hoping by the end of this webinar you're going to get a really good idea of what dairy is, what it can do for you, and if you should actually be consuming it or not. So, I mean, what is dairy? I mean, it's pretty obvious. We all know that dairy products come from cows, but just to kind of clarify, it's things like milk, cheese, yogurt, and butter as well. But dairy actually isn't just from cows. It actually refers to any animal product, any milk product. So it can be goat dairy or sheep dairy or cow dairy is kind of what we're looking at. So for the purpose of this webinar, I'm mostly going to be talking about cow dairy with a focus really on milk, cheese, and yogurt. Butter I actually recommend that people can eat quite easily. Butter doesn't have a lot of the other components in dairy which we're going to talk about. So really for the purpose of this webinar, I'm talking mostly about your milk, cheese, and yogurt. So there are actually some pros to having dairy. You know, it is a good source of calcium. Now, the calcium in dairy isn't as good as the calcium in other plant-based foods. So calcium in dairy is largely a calcium carbonate, which is not really absorbed all that well, although it is really, still an okay source of calcium. Whereas plants have different types of calcium, which are just a little bit more absorbable. So things like your spinach, nuts and seeds and stuff are probably better sources of calcium in my eyes. Dairy is actually one of the few sources of vitamin D. So vitamin D, a lot of people are deficient in. We're either not getting enough sun, or a lot of people lack the enzyme to convert vitamin D in the skin. So dairy products can be a good source of vitamin D. And normally if I'm looking at that, I'd be looking at butter. Vitamin D is a fat-soluble vitamin. It's found in the fatty component of dairy. So butter is a good way to get vitamin D intake up. It's a source of vitamin A as well. So again, organic butter is a really good source of vitamin A. And vitamin A is very important for your immune system, for your skin, for your thyroid. So vitamin A has got a few roles in the body. It's quite important. And dairy products are also quite high in protein. So there are quite a few reasons why you might choose to have dairy. However, raw, unhomogenized dairy, so unpasteurized dairy, has much higher nutrition and enzymes. Now, most of the milk that we get these days isn't actually raw anymore, so it's quite processed. So dairy is quite far removed from the milk we used to get straight from a cow. The processing destroys most nutrients and enzymes. And by enzymes, I mean in raw dairy, there's actually enzymes that you need to break down that dairy. Now, in Australia, we can't legally get raw dairy, so everything has to be pasteurized. And pasteurization is essentially just heating it at quite high temperatures for a long period of time. And what that does is it denatures the protein, for starters, which makes it not as good for you, and it also destroys some of the nutrients, and it also makes it more difficult to digest because the natural enzymes that would normally help you to break down those proteins aren't there anymore. So we can't get it in Australia. In some other countries you can buy bath milk, which some people choose to drink. I can't recommend that you do, but I can say that a lot of people choose that as an option if they are having dairy. So then there's a few cons. So, I mean, you could read through this and say, wow, like it's not really a good food, but this isn't the case for everyone. So dairy is quite a highly allergenic food, and the reason for that is because it has a protein called casein, and casein is just hard to break down. Your body does react to it quite strongly. There's a lot of people with casein protein allergies. And then it also contains lactose. So a lot of people are lactose intolerant. They lack the enzyme lactase, which is meant to break it down. So it means that they have the dairy and then it can go straight through them. It just doesn't digest it all, and then it can cause inflammation and all kinds of problems. So besides kind of looking at the individual components, I do find that dairy intolerance is just really, really common, and there's no point having lactose-free milk or that kind of thing. If you are reacting to any part of dairy, I believe that it's your body's way of saying, don't eat dairy, it's not going to be that great for you. So really, really common intolerance. And I mean, dairy, it's a hard food to break down. You know, it's meant for milk for baby cows, so it's not actually meant to be consumed by humans. It's not made for us, so it is actually a lot more difficult to break down. Dairy is also quite mucus forming, so when you have dairy, you might notice sometimes that you get a little bit mucusy on your throat, and this is just one of the properties of dairy. And for some people, like particularly if you have immune problems or asthma or that kind of thing, that mucus forming effect can actually cause significant problems. So if you do have milk or cheese and you feel a little bit you know, like having to clear your throat or that little bit of mucusy, then it means dairy is probably not the most amazing food for you. The other thing with dairy is it is quite inflammatory or acidic in the body. So acidic foods are going to cause inflammation, whereas alkaline foods are more anti-inflammatory. And dairy is one of those foods that does fall into the acid bin, so it isn't great to good to have large amounts of it. Now, it is a processed food, and we touched on this, and it's just because if it's pasteurized or homogenized, it means it's not a whole food anymore. So pasteurization we spoke about, but homogenization is how they actually stop the cream from kind of coming to the top. So anyone that's had kind of old school dairy milk will know that the cream actually settles on the top and you end up with this cream layer. Now what happens with homogenization is they actually push it at a high pressure through really, really fine, into fine particles, and they actually disperse it through there so that all the particles are the same size, and that's why it's kind of got a consistent creaminess rather than little chunks of fat through it. So the process of homogenization does damage the milk, it does damage the proteins in it, and it's generally not really good for you in that form. Now, to go one step further, UHT milk is even worse. So UHT stands for like it's ultra pasteurized essentially. So it's ultra heat treated, sorry. So ultra heat treated milk means it's pasteurized but at a really, really high temperature, which kills absolutely everything in it, which means then it's got a shelf life of, you know, a good few years. So we definitely will never want to have UHT milk if you can avoid it. Now, the other thing is with dairy is that it does exacerbate quite a lot of conditions. So some people just shouldn't have dairy. Like there's lots of studies on it, you know, and in my clinical experience, these are the things that dairy really doesn't do well with. So if you have irritable bowel syndrome, dairy is a big no-no. Irritable bowel disease is a big no-no, and irritable bowel disease is things like Crohn's disease and ulcerative colitis. Those type of inflammatory digestive conditions definitely don't do well with dairy. Any digestive problem, in my view, if you can't digest food properly and if you've got bloating or indigestion or anything else going on with the digestive system, putting dairy in there is just putting an extra strain on the digestive tract. So it is important that if you do have digestive problems to avoid dairy until we can fix them for you. Now, cancer patients as well, and that's because it's inflammatory, and we want to, with cancer, you just want to have lots and lots of alkaline foods and avoid inflammatory foods as much as possible. Autoimmunity are things like lupus, rheumatoid arthritis, you know, ulcerative colitis and Crohn's also fall into the autoimmune category. Psoriasis, any of those type of conditions should not have dairy. It's very inflammatory. You want to avoid that. It's not good for your immune system. If you have allergies, because typically with allergies it's an immune response and dairy is going to put a strain on that. Asthma, because we don't want any extra mucus in the lungs. We don't want to kind of have anything that's going to inflame that. Sinusitis is just mucus related. You don't want to have excess mucus if your sinuses are already blocked and inflamed. And colds and flus. So if you've got a cold or flu and you're already a bit snuffly, it's a great idea just to cut dairy out completely until that's resolved, because it will help with that mucus production and to kind of get it moving a bit quicker. Now, there are different types of dairy that you can eat. So milk is kind of like the standard one, and I actually don't recommend that people really drink a lot of milk. And the reason for that is because it's just hard to digest, and unless it's kind of raw and in its proper form, it's just not going to, the benefit kind of outweighs the risk in my eyes. However, yogurt is a really good health food, I believe. If it's made from a good quality milk, then it's going to be actually quite good for you. So if you get a good quality probiotic yogurt that's made from unhomogenized milk, it'll actually help to digest the probiotics in there will help to digest the proteins and the sugars in the milk, which makes it more easy to digest. It also gives you a good dose of your healthy bacteria, so your probiotics. And as you might know, probiotics are really good for immune function. They're important for the way that your digestive system works. They've been implicated in moods. So having good levels of bacteria are really, really important. And yogurt seems to be tolerated by most people, a good quality yogurt, as opposed to milk or cheese. So I do find that if people are really dairy sensitive, you know, they might be allowed to have a little bit of yogurt every now and again without a problem. So then you've got cheese, and cheese is one of those things that I think most patients are like, no, I don't want to give up my cheese. But cheese can be problematic for some people. It just depends how it's made. There's heaps of different types of cheeses. So some cheese is actually fermented using bacteria. So like a little bit like your yogurt, it means that that bacteria will break down the cheese. So what you might get some beneficial probiotics from there. So there are some really good cheeses. A good example of that is Quark, which is almost like a yogurt cheese, which is fantastic, or Labna, which you can make yourself really, really easily. On my website, naturopathbrisbane.com, there's an excellent recipe for Labna. There are a few cheeses that are good, but your kind of hard cheeses, if you are dairy intolerant, it's a good idea to keep them to a minimum. They might be tolerated better than milk just because of the curing process, I guess. But like I said, they do need to be made with good quality milk if you're having cheese. Now, low-fat dairy. Again, this is what kind of dietitians and the Mainstream Health and the Heart Foundation is recommending everyone to have. Now, I have to say that there isn't actually a lot of evidence behind this kind of reasoning for them to recommend people to have low-fat dairy. The theory is that if you have too much saturated fat, then it's going to increase your cholesterol. There isn't actually a lot of evidence for that. And in fact, there's been some kind of studies that have shown the opposite. High cholesterol generally tends to come from having too much sugar, too much trans fats, too many bad or rancid fats in the diet, and also from just things going on within your body, like your thyroid going out or hormone deficiency. So there's lots of other reasons for high cholesterol, you know, that it doesn't really make sense to cut fat out of your diet like that. So there have been studies that have shown that low-fat dairy pretty much messes with your hormones. So what happens is when you have the low-fat dairy is it's not a whole food anymore. So in dairy, you've got things like protein and fat, and also you've got your nutrients, so calcium, magnesium. But the other thing that you forget about milk is that it's a food for baby cows, so it's actually full of hormones as well. And if you break up that milk, you'll actually change the hormonal balance. So in the fatty component of milk, there's lots of estrogen and progesterone. And in the watery component, like your skim milk, there's actually lots of prolactin and insulin-like growth factor. So prolactin, if you have too much, it can actually cause problems with fertility. And insulin-like growth factor is a thing that you want to really avoid because it could cause diabetes. So you don't want to be having lots of insulin-like growth factor, you know, if you're having lots of skim milk products, because it can actually contribute to diabetes. And there have been studies that have kind of, you know, hinted at that. So if you are going to have dairy, the rule is that it does need to be full fat, okay? And it's hard for some people to get their head around this. But if you're going to have dairy, have it as a whole food, have it unhomogenized, have it as full fat. And organic is also best. So being an animal product, it is kind of prone to a lot of the things that are involved in conventional farming. So the dairy industry is really intensive. They milk cows when they're pregnant, which traditionally they wouldn't have. So when you're milking a pregnant cow, you're going to get a hefty dose of hormones for starters, but also there's other hormones that they give them to kind of help with lactation and stuff. So that's a problem. And because they are so intensive, they do tend to get mastitis and those type of things more often. So non-organic cows do get antibiotics pretty routinely, and those antibiotics are going to come straight through the milk, you know, and you're going to be consuming those. So antibiotics are one of those toxins in the environment that you don't really think about, but we're actually consuming quite a lot of them. You know, they kind of go through the food chain. So, you know, these low doses of antibiotics aren't going to be good things for our guts or our systems either. So if you're going to have dairy, it needs to be organic. That's very, very important. So full fat, unhomogenized, organic dairy, preferably raw if you're able to. So that's how we want to have our dairy, or fermented as well. So fermented dairy is going to definitely be healthier than non-fermented. So the other question is dairy actually right for you? So, you know, some people just can't tolerate dairy and don't do it really well. So you need to think, are you getting any of these symptoms? Are you getting bloating, indigestion, wind or gas, any diarrhea, any constipation, and are you mucousy? So generally, if you are lactose intolerant, you'll eat dairy, and you'll get diarrhea pretty soon afterwards, okay? But dairy can also go the other way. It can also cause constipation in people, and I've seen that a lot. I see that a lot in children that are dairy intolerant and they have, you know, diarrhea or constipation. It's something that we see really commonly, and quite often removing dairy from the diet and sometimes wheat is enough just to kind of help them. Now, the other thing is, you know, are you mucousy? And we spoke about this a little bit earlier. So, you know, if you have dairy and you're feeling a little bit kind of blocked up, then it's probably not right for you. And of course, if you have any of those other conditions that we spoke about in the earlier slides, then dairy is definitely not right for you. So if you can't have dairy, what can you have is a question. There's actually heaps of dairy alternatives. So cow milk alternatives are goat's dairy and sheep dairy. So goat and sheep dairy are actually a lot easier to digest than cow dairy. The proteins are a lot smaller, and they tend to be less reactive. So a lot of people who just really like their milk and they can't do it, they can do goat's milk, or you can get goat's cheese and sheep cheeses. So a really good example is at the supermarket, there's like some Greek feta that's made with a blend of goat and sheep cheese, and that one I recommend for patients, you know, pretty often if they're wanting, you know, something cheesy, that kind of thing. You can also buy hard goat cheese, you know, so there are, and goat yogurt at supermarkets. So there are actually a lot more options that are kind of coming out on that side of things. And of course, if for younger children, for infants, you know, if you're using a milk replacement and that's all they're having, then, you know, they need to have like a proper dairy alternative, and goat's milk is a really good one for that. And then you've got your non-dairy kind of milk alternatives. So you've got kind of almond milk, and almond milk is super easy to make. So I've got a recipe on the screen for you there. And almond milk, all you need to do is basically soak almonds overnight, rinse them, which removes enzyme inhibitors from the outside. So it just means it's easier to digest again. And then you pop it in the blender, 4 cups of water, a tablespoon of macadamia oil, which just helps it get a little bit creamier, and a good pinch of Himalayan salt, okay? And you blend the crap out of that and until it's kind of, you know, you don't have any bits in there, and then you strain it through a nut milk bag or a really fine sieve. So nut milk bags you can get like from a health food shop or buy them online, and what you do with them is you actually kind of pour the thing in, you're going to be left with a heap of fibre. So that fibre can be used in things like veggie patties. We actually feed it to our chickens as a really good source of calcium. You can also make almond milk and have it with the fibre. Like, you don't need to drain it. If you're having it on muesli or in a smoothie, you might just want to kind of make it and then pour it, you know, give it a shake and pour it in with the fibre in there. You know, that's totally fine as well. Now, the other, almond milk is probably my favourite non-dairy alternative because it's really alkaline, so it's very anti-inflammatory. It's a good source of calcium. It's high in vitamin E. It is a really good one to have in there. But the other ones that I recommend is oat milk. And oat milk is really good. Unless you're celiac, oat milk is fine. Even if you're gluten intolerant, unless you're really intolerant, oats generally don't have gluten. It's just that they're contaminated. So if you're celiac, avoid it. But oat milk is a good one. Rice milk is another good alternative, and rice milk is gluten-free. Rice milk's got quite a sweetness to it, so it is nice with kind of your mueslis and smoothies and stuff like that you'd expect to be having like a sweetness. And then the one I've got a question mark with there is soy, and soy I've got a question mark because it's really controversial. I actually believe good quality organic soy as part of a balanced diet, so I wouldn't recommend drinking soy milk every day or anything, is okay for some people, okay? And this one I would check in with your naturopath or nutritionist to see if that's going to be right for you. Some people just shouldn't have soy. For instance, if you have a thyroid condition, you shouldn't have soy. But for other people, they actually go quite well on a little bit of soy. So just talk to your naturopath if you're not sure if that one's going to be right for you. So that's it. Thank you very much for joining me. It's been a really power-packed webinar. I hope you've got a little bit more clarity about dairy and what you need to do. So remember the rules with dairy. It needs to be full fat, it needs to be unhomogenized, it needs to be organic, and preferably fermented if you're able to get that. So if you want any more information, hop over to my website, naturopathbrisbane.com, where you'll find some recipes and articles, or you can head to brisbanenaturalhealth.com.au, which also has a heap of other info and an excellent article on this exact topic in the health articles section. Thanks for joining me. I'll see you next time.